Great. Well, thank you so much for having me. So my name is Mohamed Zayed. I'm a board-certified vascular surgeon, and I'm the co-founder of AirSeal CardioVascular. And we are developing the first blood test that can help diagnose a prevalent disease, more prevalent than coronary disease, more prevalent than cerebrovascular disease. It's called peripheral arterial disease. And it's the vessel disease that occurs everywhere else in the body except the heart and the brain. Now, about an hour from now, I'm scheduled to go do an operation where, unfortunately, I'm going to be removing a leg. That's the least favorite operation that I do, because I know that I'm going to permanently disable someone. They're going to be completely dependent on somebody else for the care or simple things like getting out of their bed, going to the restroom, going to the kitchen. And that happens as an end-stage complication to this disease, peripheral arterial disease. And it's the #1 form of limb loss outside of trauma. And it's misdiagnosed, it's often misunderstood, and when it occurs really late to the point where they have to see someone like myself for limb salvage opportunities or, unfortunately, removal of the limb. And we do that to save the patient's life, right? To save their ability to be able to function, at least somewhat. And the reason this happens is because the standard way to diagnose peripheral arterial disease is not specific, meaning that it won't tell you exactly if you have this disease versus something else. The LDL cholesterol, bad cholesterol, has never been shown to be diagnostic of peripheral arterial disease. Being able to be diagnosed with peripheral arterial disease is not easy, and it's not specific. So what we've discovered in my research laboratory through NIH funding is that it's not actually the LDL cholesterol that's causing cardiovascular disease. It's the proteins, the enzymes that are on this lipid particle that's physiologic. It's normal to have LDL in your bloodstream. That's how we are made up. But there are some proteins that can be pathological, meaning that they're bad. They should not be there. And these proteins can then cause lipids to accumulate in your arteries to cause disease. So it turns out it's not the LDL that's the bad problem. It's the cargo that's on the LDL that's the bad problem. If you have more cargo, you have more disease. If you have less cargo, you have less disease. And so guess what? We've developed a test for that cargo. And that's what we're commercializing with AirSeal CardioVascular. And we've tested this in numerous patients and published this in multiple peer-reviewed articles. Our latest pivotal trial that was published in a journal, the American College of Cardiology, a highly reputable peer-reviewed journal, showed that in patients that have cardiovascular disease, peripheral arterial disease in particular, their LDL was completely non-diagnostic. Circulating fatty acid synthase, the protein that we've discovered, was dramatically higher in the patients that had peripheral arterial disease. Now again, we've published this, it's in all peer-reviewed journals, it's public access. I purposely do it public access so anybody can download it. And it's available to anybody in the public. It's all been funded by highly competitive NIH funding. This is not easy funding to get. It's peer-reviewed science. What we've also done is that we've taken that data and taken it back to the laboratory, and I've made some genetic modifications in mice for that particular gene, that particular protein, to see what does it do. Is it an innocent bystander, or does it fundamentally play a role in atherosclerosis? And you can guess what I'm going to tell you. If I knock out this gene, if I take it out, guess what? No atherosclerosis develops. And if I pharmacologically inhibit it with a molecule, guess what? Atherosclerosis plummets. So it's not just an innocent bystander, it's playing a fundamental role. If you have more of it in your bloodstream, it's bad. If you even have it in your bloodstream, that's pathological. And if you don't have it, that's a good sign. And so we've developed a test. It's an immunobody test. So basically, it's an antibody that detects this protein, and it gives you two things. Number one, do you have the protein in your bloodstream? If you do, it's like a cancer antigen, like the PSA test or the CEA test, right? If it's there, it's pathological. And number two, it tells you how much do you have. If you have a lot of it, guess what? You're at higher risk of complications related to peripheral arterial disease. Now, as doctors and patients, what can we do with this information? Well, there's a whole slew of things that we could do to improve the care of these patients when we have a window of opportunity before I have to go through this operation. Years before this end-stage complication. And guess what? We recently discovered that GLP-1 receptor agonists decrease this protein in the circulation. So there are actual medications or pharmacology that can improve the health of these patients and can reduce this protein. This is all patented, by the way. We have an issued United States patent on this. It's already issued. And we have multiple PCTs and provisionals that have been filed on this technology for both diagnostics, prognostication, and, as you noticed, potential therapeutics. This is our kit. We're developing it here in St. Louis. We're a St. Louis-based company. We're developing it here. The actual kit is right here. It has its reagents. That's the box. And we've developed proprietary agents to be able to go with this kit. This is all part of our patent portfolio and our moat on this technology. We've developed a very good market analysis where we're going to deploy this so that insurers can potentially reimburse us. We are going to be targeting this high-risk category right here, like the patient that I'm going to be operating on today. Before they need an amputation, there's a window of opportunity for at least a couple years where we can diagnose these patients and intervene on them successfully before they require a limb operation. That's the population that we're going to target, and that's the population that health providers and health insurance wants to reimburse. We've talked to the MolDX director, and they are interested in reimbursing tests that can reduce the healthcare costs in these high-risk acuity patients. Now, we've done also a market analysis, and we found that community care doctors, primary care physicians, cardiologists, endocrinologists are very interested in this test. This test will save them time, and it integrates with what they're already doing. If they're already drawing a blood draw for LDL total cholesterol, they get CPAS with it. It doesn't disrupt their pathway. It integrates with what they're already going to do. And then they identify these high-risk individuals, and they refer them to specialists like myself. And then we intervene on these patients well before they require a limb loss operation. This is our team. My co-founder, Stephen Wu, has vast industry experience. He's worked at multiple biopharmaceuticals, and he does a lot of forecasting and business development. And then we have multiple advisors. Many of them are St. Louis-based, if you noticed, and some of them have exited diagnostic companies and have scaled them. And on this side are physicians who actually write the guidelines for cardiovascular management and care. And these are the individuals that are helping us champion this new change, this new paradigm of thinking about atherosclerosis and how to diagnose it more accurately and more diligently. We're also going to scale this diagnostic in a CLIA lab as a laboratory diagnostic test. We already have established this at Washington University. These are the individuals that are going to be helping us establish this CLIA lab at Washington University. We're going to have our test completed this summer and then deploy it in this CLIA lab. And at that point, we'll be able to take tests, orders. Individuals who want to know their circulating fatty acid synthase will be able to diagnose it for them. We're also going to be able to conduct our first pre-FDA clinical trial on retrospective samples that we've already acquired from the NIH, and we're going to use that data to submit to FDA. This is our expansion chart. We're currently raising 1.5 million seed round, 500 of which is undergoing a safe round right now, which I'll mention in a second. But these are the milestones which we've already achieved, the vast majority of which, including the development of our kit. And the kit will be finalized this summer, as I mentioned. We've already initiated biopharmaceutical collaborations. There's a major biopharmaceutical that's interested in using our test in their clinical trials in the future to be able to help select the patients that are most suitable for their clinical trials. In the growth and expansion phases, as you can see, we're going to be seeking CMS coverage to get reimbursement, and then being able to expand it into commercial labs as well as hospital labs as an integrated unit in testing of patients that are cardiovascular controlled. The other thing that we're doing is we're also exploring the therapeutic angle, as I said, and that's a separate company that's not part of AirSeal because it's a very different risk profile, as you can imagine, to develop a drug rather than a diagnostic. But they will go hand in hand. So again, this is the breakdown of what we're raising right now, 1.5 million. This will allow us to be able to have the test, submit to FDA, and be able to deploy the LDT in a CLIA lab to be able to start generating revenue and value to the business, but also to help patients and physicians understand the cardiovascular risk profile. And with that, I'll stop and take any of your questions.